This is not the video I had planned today, but it somehow just didn't seem right to post a video about TikTok with everything going on in the world right now. I want to take this opportunity to talk about racial disparities in healthcare, specifically in obstetrics and gynecology, which is the field that I practice in. I do want to start this video off with a little bit of personal reflection. Black lives matter, and if you are working against the movement, you are part of the problem. George Floyd, Ahmaud Arbery, Breonna Taylor, there are countless others. These people and their lives and what happened to them matters. I have made a couple of statements on Instagram, and in response, I have gotten direct messages that said something along the lines of, "Don't you care about the looting?" I care more about these people's lives. Riots are not the goal of a protest, but they are what happens when you have tried to peacefully protest for so long and had no improvement in what you were protesting. We have watched for years as our Black communities have peacefully protested. We have idly stood by as others told them that their protesting was wrong. In 2013, when the Black Lives Matter movement started, that hashtag was immediately hijacked and twisted by other people who were completely tone deaf, making new hashtags specifically to minimize the voices of that movement. When Colin Kaepernick took a knee and peacefully, quietly protested, he was told that was wrong. He was called names by the President of the United States. These are peaceful protests, and there are countless others. So of course, I don't condone violence, and I don't condone looting or burning property, but I care more about the voices that need to be heard and the lives that are being lost. Not to mention really good evidence that most of these riots are not even being started by the peaceful protesters to begin with. So if you're focusing on that part of this situation, you might be contributing to minimizing the voices that need to be heard. On that note, I want to talk today about racial disparities in healthcare. This is not meant to be a primary resource or a full scope coverage of all the factors, problems, and solutions that go into this. Most of this information comes from an ACOG committee opinion, which I've linked below, as well as several other resources, publications, books, and articles that I have also linked below. You are free, and I encourage you to discuss in the comments, but I will not tolerate hatred of any form. I am obviously white. I do not understand racism from a personal standpoint, and nothing I say in this video should be interpreted as me pretending I do. We have a requirement to understand that racism comes in many forms and that nobody is immune to racism and prejudice. Our goal as individuals should be not to proclaim or prove that we aren't racist or that we can't have any racist tendencies. It should be to self-reflect, discuss, and be aware enough of the possibility so that we can acknowledge that and make improvements moving forward. That is just my personal opinion on this topic. A lot of this data is a little bit older. Just like all my videos, I try to research and make sure I updated myself on this topic before I started talking about it with you guys. Unlike my other videos, I am researching, filming, editing, and uploading this video in a period of probably 12 to 20 hours because I just decided on Sunday that I needed to change my video and I wanted to get this out to you on Monday like normal anyway. If you notice something I say that's inaccurate or something that has newer data to it, please kindly let me know in the comments. You guys teach me things all the time. As of 2013, about half of births in the United States were to people of color. This means that by 2050, we are expected to have a majority of people in the United States who are people of color. The faster we move towards that, the more we are noticing subtle disparities in healthcare which have been swept under the rug in previous decades. We need to put those into two categories: disparities in healthcare outcomes and healthcare diagnoses, like uterine fibroids and preterm birth, and disparities in healthcare access, like preventative cancer screenings and birth control. Let's start with disparities in health conditions and outcomes. I've talked a little bit about this in my maternal mortality video, which I will link below if you're interested in watching that after this one. Black people are almost 4 times more likely to die during pregnancy, childbirth, and the postpartum period than any other race in the United States. Black people are also 2 times more likely to experience stillbirth and at a significantly increased risk of preterm birth, unintended pregnancy, breast cancer, cervical cancer, death from diabetic conditions, and many other health conditions that are unrelated to what I do. Now let's cover disparities in healthcare resources and access. Although some of these disparities in outcomes and conditions are diminished when you control for things like socioeconomic status, many of them are still very significant. This tells us that there is more at play than socioeconomic status and access. So what are those things? We can kind of group those into 3 categories: patient, system, and practitioner. What are patient factors? Patient factors include genetic, cultural, familial things that can contribute to health conditions. Also includes environmental factors, exposures, and things like that. I consider this category the low-hanging fruit because when we talk about healthcare disparities and we compare it with race, this is where everybody always goes. It's easy to blame the person and their environment and ignore the other bigger factors or factors that are harder to talk about. It's just not the whole story. One thing I do want to point out is that there is most certainly a life stressor factor that goes into healthcare outcomes for pregnancy outcomes in people who are Black. And one of the theories here that is held up to some pretty substantial research is that stressors from racism itself may be contributing to poor pregnancy outcomes in people who are Black. Like we talked about earlier, preterm birth, stillbirth, maternal mortality. I have linked an article below that is interesting and goes over this. And I really just want to point that out because when we talk about racism contributing to these factors, another thing people like to do is just blame the healthcare team. And although we will get to the practitioner and healthcare team part in just a minute, there are factors of racism that contribute to everyday life stressors for people who are Black that could be contributing to poor outcomes as well. And I want to again reiterate here that nothing I'm saying should be taken as me saying I understand on a personal level what all of this means. I'm simply trying to relay the information to you guys as I understand it. And if I say something that you feel like is either inappropriate or inaccurate, particularly if you're someone who lives with this every day, please tell me. I want to know. Let's go over some systems issues. The United States is the only developed nation in the entire world that has a healthcare system which does not see access to healthcare as a right of citizenship. In addition to the fact that racial minorities are significantly less likely to be insured by public insurance, they are also more likely to live somewhere where Medicaid has not been expanded, meaning they are more likely to have less access to the government-issued insurance that we're trying to make accessible. These programs, while important, they are not always upheld to a standard that actually improves access across the board. And that's based a lot on voting and expansion laws. So the systems that come into play here involve knowing who you're voting for and what they are trying to implement as far as access to healthcare. If you live somewhere that is voting to decrease Medicaid and Medicare expansion, and you have a large community of racial minorities, you are decreasing their access to healthcare directly. I don't know what the answer is to solving the healthcare crisis in the United States, but I do know the answer is not making it harder to access healthcare if your skin color is not white. That will not solve the problems of disparity that we already see. When you add on top of that, the geographic disparities in healthcare facilities and resources, as well as the broader racial injustices that permeate our society, you have a perfect recipe for making no change or worsening healthcare disparities as a result of your skin color. This is systemic racism. This is institutional racism. This is taking all the socioeconomic factors out and still seeing disparities in access to healthcare. This is what we mean when we say systemic racism. Let's talk about practitioner factors. Not only is this one of the areas that's more difficult to research well, It's also more difficult for most people to discuss, including me. Like I was saying earlier, we want to imagine that all of us are immune to racism. We want to imagine that because we have friends who are Black, we love our Black colleagues, we support Black Lives Matter, that we can't be displaying any form of prejudice. And it's simply not true. Continuing to pretend that contributes to the problem. We have to get to a point where we all understand that some of our behaviors, some of our actions, some of the way we interpret the world and information is deeply rooted in both the way we were raised and the prejudice that was put there in our lifetime. You don't just get rid of that by saying it's not there. You get rid of it by paying close attention, self-reflecting, discussing, and being aware the problem is acting on it. The problem is not that it's there. The problem is that it stays there because we stop looking deep within ourselves and understanding how we're interpreting the world based on our history. We can't control how we were raised. We can't control what was put into our brains by our parents. We can make a difference in that in our own children. We can make a difference in that in our own selves now. So I would encourage you to, if you are in the healthcare field, or if you're not, I think anyone could learn from this, to check out a list of resources and books below that will help us all understand racism better. I'm at the very beginning stages of this, and I'm ashamed to say I haven't dove into this sooner, but I'm doing it now, and that's better than never, and I hope you will do that along with me. Back on the topic of practitioner factors that go into healthcare disparities from race. There is some historical context to consider here, which contributes to this discussion heavily. Stereotyping, bias, research that lacks diversity, these all contribute to poorer health outcomes in people of color. Additionally, there is cultural distrust because of the past and how people of color were treated by the medical community. And some of that still is very pervasive today. We don't see it in the overt, disgusting ways that it was done in the past, where J. Marion Sims experimented on Black slaves. And we don't see it in the way that it was done in Puerto Rico, with testing birth control pills without people's knowledge, coercive sterilization of people who were Black. Now we don't see those things, but we see lower levels of those things, and it's quiet. It's subtle. It's less long-acting contraceptives being offered to people who are Black. It's less research diversity. It's subtle things now. And that's really important. But it's also important to recognize how that history contributes to a cultural distrust, which may still be present either overtly or in an underlying fashion as a patient factor that goes into decreasing a patient's likelihood to seek care if they have access to it, or to trust you as a healthcare provider when they do seek care. Having an open conversation is really, really important. It can even just be asking the patient how they feel. Do you feel like you were heard today? Do you feel like we are on the same page? Is there something I can do better to listen to you? And you have to do it genuinely, because if we want to build that trust back, it takes one person at a time. Listen to your patients, get an understanding of where they're coming from, and that onus is on us as healthcare providers. Be part of the solution here. So that brings me to my last set of points, which is how do we fix all of this? Again, I do not want to pretend like I have all the answers, because I simply don't. Nobody does. If they pretend like they do, they don't understand this issue well enough to be discussing it. I want to fall back on my main point for this video. One of the biggest ways we make improvements in health disparities for people of color is to acknowledge that we are not immune to racism or prejudice or stereotyping as practitioners. We have to find ways to increase awareness, which is something I hope this video has provided at least a minutia of help in. We need to advocate urgently at the systems level. We need more diverse and better conducted research, and we need reductions in socioeconomic factors that contribute to this. Thanks for being here today, guys. I know that was a little bit of a more detailed, heavy subject. I hope that something I said made sense or was helpful. I am now saying all this and wondering if there was even any value in anything I said, so hopefully when I go back and edit, the answer is yes. We have to keep working towards the change. You being here and listening to this video is a step in that direction. Share it with someone that you know if it helped you. I would love for you to come back next time. Be kind to yourself, to each other. In the comments, if you decide to discuss, please do so in a way that leaves the comment section better than you found it. Be kind. I will see you next time.